I launched the company, and very early on, it became very clear that AI would be the way we would grow and scale this business. So I met our CTO, asked him to join me and be our leader in helping us figure out how to build what we considered, before it was even a thing, like vertically specific, deep, useful conversational AI that would transform healthcare.
I'm Jake Aaron Villarreal, born and raised in Silicon Valley, and here to take you behind the scenes to share what it's like to be a startup founder, the journey they're on, the problems they face, the products they build in an effort to make our lives better. I'm excited to have with us today Amy Brown, founder and CEO of Authenticx. Amy, welcome to the show.
Thanks, Jake. Great to be here.
Well, excited to have you here. A little bit more about Amy. She not only leads the company, but Authenticx is the conversational intelligence platform that analyzes and advocates customers' voices at scale to reveal transformational opportunities in healthcare. Amy built her career as a rising executive in the healthcare industry, during which time she advocated for underserved populations, led and mobilized teams to expand healthcare coverage to thousands of Indiana residents, and learned the nuance of corporate operations. In 2018, Amy decided to leverage her decades of experience to tackle healthcare through technology. She founded Authenticx with the mission to bring the authentic voice of the customer into the boardroom and increase positive healthcare outcomes. I love the space you're in, and I love what you're doing. And we'll talk about AI and how that weaves into your platform. Before we do that, where are you joining us from today?
I am here at our headquarters in Indianapolis, Indiana.
When I started this podcast, I had this vision to go behind the scenes to share what it's like to be a startup founder in Silicon Valley, where I'm born and raised. And weekly, we dive deep in the trenches to find the wins, the losses, and the lessons learned, with the hopes that it helps you run a better startup. But here's the thing. If you've gotten any value out of these conversations or been inspired at all, hit the subscribe button. And I get it. Your podcast feed's probably overflowing. But to stay up to date with what's going on in Silicon Valley, stick with us. Because at the end of the day, we're all just trying to build something that matters. And we're better when we do it together. So hit that subscribe button and follow us wherever you find your podcasts. Now, let's get back to the show. Very cool. I worked for Oracle in New York, and one of our first clients was actually my first client for Oracle was out of Indiana. So
You're
I
familiar.
love that. Yeah, I'm familiar. I love the area. And isn't Salesforce, don't they have a large population of employees in Indiana as well?
Yes, a major hub for Salesforce is downtown Indy, and a big presence. One of the biggest acquisitions, maybe the biggest acquisition in Indianapolis's history was the acquisition of ExactTarget by Salesforce back in 2016-ish, I believe, and really booming since. So.
Really cool. Well, you're leading and running really an AI company. Prior to that, walk us through your background a little bit. Let's dive into your origin story of kind of how did you start and how did you end up as a CEO running your company? So it's a lot in there, but let's take us back to your adolescence. What kind of drove you to maybe be a leader or an operator or in general, just someone who can communicate well and solve problems?
Yeah, I think at some point in my growing up, I just developed this strong need to be an advocate for justice. I think it had something to do with being the only girl around brothers on both sides of me age-wise. And I just had to learn to compete and get my needs, known by the family. And that kind of advocacy mentality in my DNA just kind of followed with me through my education. I grew up, my dad is cardiothoracic pediatric heart surgeon, my mom a special ed teacher. And I thought for a while I might want to go into clinical healthcare. Through some internships and fainting spells, I realized I was not cut out for clinical care.
Okay.
but the passion around our healthcare system and improving our healthcare system for patients just was very much ingrained in who I was becoming. And so I pursued an education in social work and landed my first job out of graduate school was in state government, helping run policy, making decisions for the governor on things related to Medicaid and patient populations. And that kind of gave me my foundational support of understanding how policy shapes the everyday lives. And then I landed for the next 15 years or so in the private sector working on health plans. And in those roles, I was always an operator. I was running contact center operations. I was interacting with doctors as well as insurers, as well as patients. And I really got my footing as a leader. And also, I began to really discover the power of the conversations themselves that these big companies, big insurance companies have with patients and consumers like you and me every day. And we were storing those conversations by the tens of millions on our servers and doing literally nothing with them of any value that could help the business, let alone the patients. And so over the course of my career, just like step by step, it kind of led me to the moment in time where I realized I wanted to start Authenticx. And I only realized what was happening from the rearview mirror, right? Like sometimes in our lives, we don't know that there's been this like path we've been walking down that makes total sense for where you are today until you look back in the rearview mirror and you're like, I know why I had this experience and that experience. It all prepared me for this moment, and that's how I feel about the leading up to Authenticx.
Yeah, that's great. I love that intro. And, they say life is happening for us, not to us. So if you look at whether it's good or bad or lessons that you learn, like how do you apply that for what you do next and being able to have that preparation of, the industry and the policy and just in general seeing like what was not being utilized at a level it could be is great. But then you have this big shift globally of AI. And for people that don't know AI, it was like, okay, ChatGPT, but you really started this before all that came out. How did you know that AI had to be central to what you were building in 2018, 2019?
Yes. Well, it actually started for me based on a different phenomenon going on in the marketplace when I was working inside these corporations, which was this kind of obsession over consumer experience. Industries all over were waking up to, hey, we have to compete based on experience or we're going to lose to the competition, right? And so what sprung up in the 2000s was this idea of, customer reputations scores and in net promoter score, NPS, survey-based tools for uncovering what's in the hearts and minds of our customers so we can retain them or grow new customers. And that was all happening while I was working in industry. And I was over here in the contact center running contact center operations, storing these millions of interactions and going, why are we serving these people? They're telling us all day, every day, what they love, what they hate, the stories of their lives, how we've helped them, what they really need, what they wish we had. And we're not even listening to that. Instead, we're asking them to complete a survey. And so that was the start of there has to be a way to leverage this data more efficiently, and I'm going to go figure it out, right? And so I launched the company, and very early on, within the first few months of having a couple of beta clients, it became very clear that AI would be the way we would grow and scale this business. And so I met our CTO and asked him to join me and be our leader in helping us figure out how to build what we considered, at the time, before it was even a thing, like vertically specific, deep, useful conversational AI that would transform healthcare.
Healthcare is such a big area, and technologies for years have been trying to tackle parts of it and optimize it and make it more efficient. Tell us about the space within the healthcare sector that you are focused on. We look at we look at the industry and say, okay, what product or service are you providing that someone's worth paying for? And then how are you delivering that? So give us a use case of, you talked about patients talking in contact centers, and you talked about insurance companies on the other end. Like who are you selling to, and who really benefits the most out of the platform you're bringing to market?
Mhm. So the three core industries we serve within healthcare include pharmaceutical manufacturers, health insurers, and health and hospital systems. In terms of size of our revenue and client base, it's in that order, with life sciences, pharmaceutical companies being our highest, where we've grown the most. Although we have many very large payers in our client base, as well as a few providers. Who would want to use this technology, and why would they want to listen? There's really three main functional areas within these industries that we help solve problems for, and they're different, which is kind of cool because the voice of the customer, these call recordings, chat recordings, they are a unifying source for corporate teams that come together cross-functionally to use the voice of the customer as their kind of beacon. So the first kind of core use case and user type is related to compliance. Compliance leaders have a responsibility to make sure that whatever's said in these conversations to providers or payers, whoever that company is having a conversation with, they are being regulated about what they say, what they promise, what they don't promise, how they're safeguarding privacy, et cetera. And so we have AI models that are geared specifically for the healthcare industry that listen for risk of non-compliance and help compliance leaders identify at scale. And when I say at scale, I mean at, looking for signals across millions of interactions, where are the hot points or risk points of our business, and being able to drill into individual conversations and identify where non-compliance is happening. The second core use case is the most traditional use of conversation data, and that is to help improve agent performance. So we have AI models geared to listen to the agent side of the conversation. How effectively are they representing the brand? How effectively are they delivering a high quality experience in that individual interaction? And we have models that help provide coaching and training to an agent on demand versus waiting for their one-on-one with their manager. And then the manager can look at how AI has scored their agent and use that as a kind of a prep for their one-on-ones. The third use case is my favorite because I feel like it's the most undermined, underutilized, overlooked component of conversation data, and that is what the customer is saying. I mean, it's everything from what they're talking about regarding global events, market events, competitor events, things that the C-suite cares about, to what they're saying about your brand, your commercials, your website, your patient portal. And this is all unsolicited. This is like, hey, I had to call you today because your online tool didn't work. Or I tried to use your chatbot and it failed. Or I've got this problem. You promised me something a week ago when I called, still haven't gotten it, right? And these things are these comments are the leading indicators for your revenue this year or your NPS scores. And we're not corporations have so often undervalued this data source as a really rich source of leading indicators.
Yeah. Yeah, that's incredible information to get. You never get that information unless you have a third party maybe interview your customers, or have a different way of, getting that insight without them feeling on guard to really share what they're feeling. Or just if you hear it, does it really get to the decision makers that need to hear it?
Right.
So,
And
in terms,
decision makers, they want to be data driven, right? So a few surveys or a focus group can be really deep and contextually rich, but not necessarily representative of the total of what's going on with your customer base. So the beauty of AI is it gives you scale to listen in real time all day, every day, 24/7, and point you at like a representative picture of what's really going on in your business from your customer's perspective.
Yeah, totally hear that and agree with it. When you are going to market, who are you selling to? Who cares most about this data when you're in the sales process?
Yeah, so the teams responsible for P&L of particular lines of business. So in pharma, that could be brand teams, teams that are responsible for the therapies that you see on commercials at night when you're watching TV, or the leaders who have an entire kind of therapeutic class that they're bringing this set of therapies to market. In the payer space, it's the leaders who are responsible for member retention, making sure that every open enrollment period that they lose as few members as they can and they grow net new members. In the Medicare space, the federal government, you know, ties value to customers' perception of the health plan. And we're talking millions and millions of dollars per health plan. And so it's very important for corporate leaders on strategy, on growth to care about this very operational data source as much as it is for the operators who are running the contact center and need to know about the quality side of it. I mean, the beauty of it is this data source is already under your nose, regardless of whether you've been aware of it or not, and it has something of value for every functional area of the business.
Yeah. What's the competition like in that space? There's a lot of data analytics companies, and they're in different sectors. You've been doing this for some time, and specifically with AI. Do you have a head start in this area? Like, what's that like?
Yeah, it's probably one of our the greatest components of our moat is that we've been developing AI exclusively for healthcare conversation data for 6 years now. And so we have very sophisticated set of data, training data, and very sophisticated models that have been trained and tuned over years now. When we started, certainly there were a lot of data analytics companies out there. Most often than not, they were utilizing structured data, lagging indicator data to tell a story. And one of the really cool things about conversation data is that you can use elements of it like a human's voice or a transcript to help tell the qualitative side of the data point, which is really, really important when it comes to inspiring change within an organization. I've seen leaders sit back and look at a dashboard, bar charts, and line graphs that tell a very compelling story, but they're still kind of yawning and they leave the room and they don't really, take action. But when you combine those graphs, those visualizations with let me play you a montage of 5 of your customers who complained about this therapy yesterday or this provider yesterday, and executives have to hear like clip after clip of customers telling their real story and they're talking to their people yesterday,
Yeah.
right? That it changes the game for them. It becomes emotional and it becomes personal. And so it's that combination of data and experience for our users that makes it so compelling. And we before Authenticx, I had never seen a product that combined qualitative and quantitative data to tell a really, really compelling story before.
Why is this space so important to you?
Because we are the most expensive healthcare system in the world, particularly in the wealthiest nations in the world. We are, while being the most expensive, like you could justify that if we had the best health outcomes, but we don't. We score the lowest amongst the wealthiest nations in our world. So we're paying a lot and we're getting very little out of it. We have the highest administrative expense of any country in the world. We are wasting so much money while not improving health of our citizens. And our glimpse into this data source, and just to give you a sense, last year we listened to 300 million patient voices. There are 330 million people in this country. So we listen to a
Wow.
lot of voices. It's a lot of data. We listen
Yeah.
to 300 million customer voices, and it is so evident that there is opportunity to reduce waste, reduce cost for businesses, for regulators, while also improving the simplicity and the navigation of care for all of us. And we just need to listen to the data and then take action based on it. Sounds very simplistic. I think one of the cool things about being a tech company in this industry is we're ingesting data from all the different verticals within healthcare. We're not representing a particular agenda, only like what the truth is according to the American consumer. And so I think we need to have a seat at the table saying, like, let's just look at the data from the perspectives of American consumers about what is standing in their way of getting the care that they need. They're telling us every day.
Yeah. That's incredible. Yeah. That's a lot of voices, by the way, to listen to. You talked about AI and your technology and the moat. What's the biggest differentiator that you bring to the table?
Yeah, well, one of the things I'm really proud about is when we decided we were going to build AI, we said, okay, if we want to feel really good about our AI, what do we need to do? So, one of the things we said is we're only going to use training data that is relevant to the market we're going to serve. So, we're not going to go scraping free data off the web for our training models. We're going to actually use, with our clients' permission, their own customer interactions to help us train our models to find very real problems for our customers. We also, instead of just throwing a bunch of data scientists and ML engineers at it, we included human listeners and data labelers who are trained in the healthcare space. They're nurses, they're counselors, they're social workers. They're people who don't only understand the spoken word, but they understand the context of the situation, which means that our models are more relevant and available and accessible to our clients out of the box. So many speech analytics companies that are out there are horizontally focused, and they might have tools for clients to go figure out how to build a word search or a particular AI model. But that takes time. It takes resource on our client side or the market side. And we have done all that work for them so that truly business leaders, people who don't have a technical background, use Authenticx every day to get answers to their questions. And it's completely AI powered. And it's just much more business friendly, speed to value.
Yeah. That's great. It's personalized based on the sector. You mentioned that you're focused in pharma and payer verticals. What are the challenges with serving that industry?
For me as a tech company, or for that industry? Like, from what perspective are you asking?
Yeah, from the industry, when you look at you have a new technology, you're coming into the space, which has been established for a long time. There's probably a lot of relationships and vendors and like what are the challenges to breaking into that sector
Oh,
and serving that industry?
yeah. Well, it's a very conservative industry, highly regulated industry. And particularly in the past year, we have shareholders of those industries who are screaming like AI all the way. We want to, improve profitability. We want to be tech forward. I want an AI project going on in every part of our business. Like, there's that kind of interest and demand, but there's also, like, over in the legal and compliance departments, a lot of fear around, well, how do we do this in a way that we don't end up on the Wall Street Journal? How do we do it in a way that is responsible? How do we do it in a way that is protecting patient privacy? How do we leverage this cool technology safely, securely, and that protects our reputation. So that's the intersection of the gist of where we sit, right? And we have to be very, very good, very expert at consulting them about how to have proper AI governance, why, what they should expect in terms of true responsible use of AI, also helping them see the art of the possible to transform their business. And it's lots of fun, but it is there there are it's never a like one person makes a decision in our sales cycle. There's always,
Yeah.
like, out on the client side, there's always committees of people, right, that are part of the buying decision, and so that's challenging.
Yeah, it's like selling to Congress. You got to get everyone on board and vote and
Right.
share their input. There's this like landscape of contact centers and call centers, and we hear a lot about the shifts of the industry, and you know, call center and customer support's going away. It's going to be AI driven. We can cut out the cost and respond with bots to questions that customers have. This unknown of where that's going, does your technology help with the voice and the communications in addition to like text interaction? Like, what's that look like for you?
So yes, every company is thinking about how do they make a more seamless, accessible customer contact center that answers customers' questions without having to leverage human resource. In the healthcare world, there is just complexity upon complexity. We see opportunities to certainly automate customer service for some very low level inquiries, but there are plenty of inquiries, needs that still need higher level human intervention. That said, AI can help prepare a customer service rep, help them interact more effectively in their interactions with patients and doctors, and ensure that they are delivering a higher level of service than they do today. One of the cool things that no matter what channel a business decides to communicate with a customer, whether it's automated, a bot, an AI assistant, or a human, that customer is interacting with you in one way or the other, whether it's over a chat or it's a voice, and they are telling you something that is worth listening to. And so we're kind of agnostic to what your channel is. Like, we'll we will give you insight no matter what channel you're communicating. The key ingredient is listening, because no matter what, there are things going on in the world, there's things going on in your business, in your with your people, your product, that need to be adjusted and tweaked, and you need to be listening real time, or else you're missing opportunity to predict your revenue appropriately.
Yeah. Yeah, there's a lot of moving parts happening in every sector right now, and then when you bring AI into it and you try and figure out where do you apply it, there's still a lot of unknowns. But when you're talking about healthcare and people, you want to talk to people. Like, a bot might help you get scheduled or maybe get you to the right department. But when you're talking about insurance or your doctor or whatnot, they've done a number of studies and people want to talk to people when it comes to their health.
That's
So
right.
I
And
don't know if that's going to change that much, at least in the short term.
I agree with that, Jake. And just to share a little funny, not funny story with you, we serve a lot of payers, and the number one source of profanity, when you go and search profanity in our tool for those particular clients, are coming from customers who are engaging with the chatbot, because they really are just asking the chatbot to talk to a human, and they get so frustrated that they cannot get to a human, that that's when the profanity comes out. It's quite fascinating.
Yeah, we've all been there. I understand
Yes.
exactly what you're talking about.
Yes.
What do you wish the market was talking more about right now?
Mm. I wish the market were talking more about the role of humans and what we want it to be in a post AI implementation world within our businesses. I see where from my seat where we're interacting with executives and buyers from very large healthcare organizations, the focus is still too much on the shiny bell and whistle and the kind of short-term gains that can be made to profitability or growth or whatever it is without enough thought about, wait a second, what do we want, whatever our human resources look like on the flip side of this implementation. Sure, we might want to downsize some, we might want to repurpose some, but what do we want our human value to be post AI implementation? And they're not talking about that, and it's creating a lot of chaos and conflict of interest for the rank and file who are being asked to go implement AI. Like, they need to know and feel like AI is going to be a tool that's going to help them elevate their own career or, gain new skills or be able to do different things. And without that very real conversation happening within these companies trying to implement AI, they're shooting themselves in the foot without even knowing it, right? And so we just need to have a very open conversation about it. And then even more macro than that, we need to talk about as a society, what do we want humans' role to be, after AI evolves to such a degree that it can take care of lots and lots of things that today we do. It's okay that we're leveraging it, but what should we be calling ourselves to? What should we be aspiring to in a post AI world? And I just think there's a lot that needs to be discussed there, and I wish we would more.
Yeah. Yeah, I like that, and it's there. That's true. I mean, we're in the people side of the businesses. We help companies grow and recruit, and we help companies that are implementing AI, like to add people that can support those new installations of technology. And yeah, there's a lot of fear, a lot of unknowns with current employees working at a company long term. Like, is their job going away? How long will they be there? Do they need to get more skills? And I think some of it is no one totally understands yet, but it's at the same point, people aren't going away. They'll just get better
Hmm.
if they use the tools, if they adopt it. If they don't, I think there's probably an issue for the value that a human could have in a company where you should be able to maximize the tools that you have. And, agentic AI is coming, and that can be a benefit for the company. Also could be a benefit for the people leading departments that are using that technology. So a lot going on there.
There is, and I just wish there was more intentionality at the highest levels of orgs to kind of start talking about that, right? Long term, because
Yeah.
it's important. So
Yeah. You've raised money. You've got 120 employees. Is that
yep.
130, something like that? Okay. What's been the biggest breakthrough for you as a leader of building a company and now where you're at this point where you got people, you're supporting families and lifestyles for employees, and you're, serving a market? What as a leader has been something you could share with audience, which are comprised of other leaders of companies and founders and startups? Give us your take.
Yeah. For me, what I've discovered through this journey, right? I've been an employee before at differently sized companies, and now I'm a founder and CEO of a company that's grown from 0 to 120 in 6 years. And I have learned that the conviction that I have for the work that we're doing is the best. Number one, it's the best coping skill I have when the motivation of being a startup founder starts to wane, because motivation can come and go, right, with how things are going in the business, but your conviction should hold you through. So I guess my comment to startup leaders is, hold on to your conviction. If you don't have strong enough conviction that picks you up off the floor when things are really bad, then like you got to figure that out, because that is what is going to inspire you to get up every day. It's also what's going to inspire other people that work for you to get out of bed every day. And I don't know where I'd be, but it wouldn't be still sitting here if I didn't have the conviction I do about the work that I'm doing. And for leaders in general, I've just learned a ton over the 6 years about transparency of what's going on in the organization. I've been more surprised than not that people can handle the truth if you tell them, and the good, the bad, the ugly. And I have really changed as a leader about how I share information with the broader team, because I've learned that people can handle more than what you think they can, you know?
Yeah. Yeah, that's a huge breakthrough, and it's one I went through as well, where you think you need to protect people and, like, their mindset or their interest level might change if they know these things are coming which aren't positive, but they get behind it. Like, if they believe in what you're saying and they enjoy being at the company and your leadership, like, they're like, "Okay, well, what can I do to help?" And all of a sudden, they go from someone you're trying to protect to they're actually trying to protect you. So, it's really cool to see how that works. It's also a little scary to start the process if you've never done it because you're not sure the outcome and you just have to go through it. You got to jump off the cliff and see the result. So that's a big one.
Yeah.
That's a really cool one.
For the first time in a all company meeting last week, I had a slide that just had an elephant in a room on it. And I used that. I was like, guys, we're just going to talk about the elephant in the room. And I said, here are the questions that you wish you would ask, but you probably aren't asking. And we just started talking about them, right? And I was amazed at the response. You know, they could handle it.
Yeah. You know what that could really play well into is when in a customer presentation meeting too, when you know the issue and they know the issue and they're not sharing the issue with you because they feel maybe you might not like to hear what they're going to say, but just putting the elephant in there, calling out what you think might be going on, let's just get open about it. I think it helped drive better alignment and communication. So
I
it's a good
love
idea.
that. That
We're
is
going
a
to
good
steal
idea.
that.
I'm gonna try that. I think we could even try that in our sales calls, like with companies that are, mid funnel and haven't committed yet or whatever.
100%.
We'll try that. See
Um,
how it goes.
I'll share something with you just happened this morning with us with that.
Okay.
We're in the business of helping companies grow and hire. There is this Web 2 sector of companies. It's, Internet 2.0. And then you have Web 3, which is, more cryptocurrency and blockchain and smart contracts, kind of different skill sets, communities that you don't find on LinkedIn. They're really like distributed globally and on Twitter. And so when a company we work with asked us to find people, we had to go in different areas. We
Mhm.
finally found and have been working on an opportunity for a long time, and they have an offer that they want to put together for a few candidates, but they were slow playing us. Like they've got a candidate they liked. We thought they were going to put an offer together, but we didn't hear for a few days. So I went back and forth on text with the CEO and finally just said, "This is what we normally see when this happens. You have an offer that's probably going to another candidate or two, and you want to make sure that you get the answer first before you come back and share if you're interested in finally putting an offer together for a candidate from a third party like ours, which is very normal. So just let me know what's going on, and it's all good either way." 2 days with no communication within 5 seconds, you're right. And then we're waiting here, and then 20 minutes later, get an email. We want to put an offer forward with your candidate. That's like literally happened an hour ago.
Wow.
So, but it was
Sorry.
at some point you just got to be straight up,
Yeah.
right?
Yeah.
Let's
Good for you.
get to what do you really need, and are we going to work with you, help us help you?
Right.
So, but it's kind of similar to the elephant in the room because you know what's going on. Let's just talk about it. It's all good.
Yeah.
Um,
Love that. That's a great example.
well, as a company, I love the space you're in. I like the fact that you were into AI prior to all this craziness is going on, and it sounds like you've got a lot of traction. If anybody wants to find Authenticx, where do they go? And if they want to find you, where do they go?
Yeah, so Authenticx.com. It's the word authentic with an X at the end, .com. And then you can find me, Amy Brown, on LinkedIn.
Very cool. Easy. Well, Amy, thanks so much for coming on and sharing your story. Really appreciate your time. And for the listener, for listening, it means a lot to me. You spent your time with us today. I'm your host, Jake Aaron Villarreal, signing off for now, but can't wait to catch up with you all on the next episode. Until then, Amy, the world, take care. If you like what we're doing, don't forget to subscribe. Leave a review on Apple Podcasts or wherever you listen. And follow us on YouTube, where we go behind the scenes to learn what it takes to be a startup founder.